Hello, so today I'm going to be practicing tracheostomy suctioning. So I have my package here and I'm going to open it up on a sterile field. Okay. So open it up. And here's my sterile packaging. So open it up. Right, and the first thing on top is that little box, or my cup for saline. So I'm going to carefully grab that without touching anything else. And then I'm going to use these two edges to pop it open. And so here I have my sterile saline that I'm just going to pour into this cup. Alright, and then next I will be putting on my sterile gloves. Alright, sterile gloves are on. So with this practice, I'm going to consider my dominant hand sterile and my non-dominant hand non-sterile. Okay, so we have our catheter package right here. So with my dominant hand, I will grab the catheter. And so I'm going to attach this tubing to the wall tubing that will actually suction. So I would grab the wall tubing with my non-dominant hand and attach it to this port right here. And I would keep control of the suctioning device with my dominant hand. And so before I insert it, I want to dip it in the saline solution. And I'm going to check the suctioning by placing my non-dominant thumb right over this Y port right here. So this is how I would check, this is how I would check the suctioning. Okay, so before I insert it, I will ask the patient to take about 3 to 6 deep breaths, and also that I will be removing their oxygen, which I will be doing with my non-dominant hand. Alright, so here's my bottle. Alright, and I would quickly insert the catheter until I feel resistance or if the patient coughs, and I will not be occluding the Y port during the insertion. So, but while I do it, once it's in there, then I can start rotating and suctioning. So you don't want to do this for more than 10 to 15 seconds at a time, and once I remove it, I will tell the patient that I'm going to be replacing their oxygen with my non-dominant hand, and that I would like to have them take several deep breaths. So actually, also between attempts, you want to have this coiled around your dominant hand, okay? So between attempts, I'm going to flush it with saline, okay, occluding this Y port. Alright, and if additional suctioning is needed, you need to wait about 30 to 60 seconds before your next attempt, and to not exceed 3 attempts in one session. And also between those attempts, you need to encourage the patient to take deep breaths and cough in between. Alright, so once that's done, after you have multiple attempts, you want to remove your dominant and coiled catheter, your dominant glove, by turning it inside out around the coiled catheter, okay, and get rid of that. And then you take your non-dominant glove off, as well as getting rid of all the materials, typically in a biohazard bin. And then when you've finished up, you want to offer the patient oral hygiene, and you also need to reassess their lung function, so their lung sounds, respiratory rate, oxygen levels, because you were removing and replacing their oxygen. So just reassess all of that, as well as offering oral hygiene, and that's about it.